Hi all, good afternoon. Today we are going to discuss about psychosocial aspects in palliative care. Before going to the session, let me have a small uh, orientation about this topic. Do you have any idea what we are going to discuss today? What is the inner, what is the internally what we are going to get into the topic of psychosocial? Can anyone please unmute and share your thoughts, please, about the topic what we are going to discuss? Like few of your intuitions might be. So I would like to have an interactive session, by the way. So either you can unmute yourself and share your thoughts, or else you can put in chat box. So what do you expect, or what will be our class all about? And after reading the topic of psychosocial, what sort of thoughts you are having, and how this topic is coming into palliative care, and how much influence it is, and why is it important? So may I have a few thoughts from your side? Anyone?
Kindly respond unless and until you people interact, our sessions will get bored.
So Vaishnavi was telling that psychosocial aspects is something which we are going to discuss more about the ones who are having anxiety. Is it like that, Vaishnavi? Can you make my point clear? Anxiety related disease, stressing patients, management, okay, providing psychological support to the family, okay. Anything else you want to share? It's about how patients are being treated by others, okay. By reading the term psychosocial itself, we can understand that something we are going to learn more about, mental health related points, as well as some sort of points which comes under the social aspects. So today, we just want to know why this psychosocial, like the mental health as well as the social part, is important in the category of palliative field. Also, like how much important is this, and why do we want to address it more similar to the kind of physical distress? So this is more about how we are going to deal our patients, like to tell a person I'm totally cured, or I'm totally having that so-called happiness, by only addressing the physical aspect doesn't work. So if you want to cover up a person's, like if you wanted to heal a person in a very good manner, we have to consider not only the physical aspects, as well as not only the physical aspects, but the psychological as well as the social aspects. So stigma being put into patients, yeah, of course. So all these kind of things, or all these kind of myths, or all these kind of thoughts is coming under the so-called psychosocial category. So today we will be discussing more about that, and how we are going to deal in palliative care patients, and why do we want to deal those kind of psychological or social problems. So moving forward, I think everyone is very much familiar and might have been seeing this definition in most of your 16 sessions, I think. So here, like I'm not going to again explain what palliative care based on WHO, but here I'm going to stress the few words, which is psychosocial and spiritual. So I will be focusing more on the psychosocial and spiritual part. And for a full betterment or for a complete treatment, we have to consider these two areas also. So, just reading out the definition by WHO, palliative care is an approach that improves the quality of life of patients and their families facing problems associated with life threatening illness through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, which is physical, psychosocial, and spiritual. So, moving forward, this is a small article which I took from Indian Journal of Palliative Care. So this person, like Irene, she's a nurse by profession, but later she got like she went into the masters in psychology and social work just to know like how much important the psychosocial factors is. And in her learning process, she quoted these lines, that is, the quality of life for patient and the manner of their dying is sometimes physic more influenced by psychosocial factors than by physical factors. So what did you understand by this? So, like, what are the thoughts which comes to your mind when you read that it is more influenced by psychosocial than by physical factors? Please share your thoughts. So, first of all, do you feel like is it more important to focus more on the psychosocial factors than the physical factors? Do you agree with that?
Yes,
Okay, great. So, like, why do you want to agree? Like, what makes you say that you agree with that point of giving more importance to psychosocial than physical? So, who was the person who said yes?
We expect the response from the person who said yes.
because he's in more stress and there is no cure also.
Okay, by focusing just on the physical matter, physical side, right?
Yes,
Okay. So here she was telling, like Aaron was telling, like the dying of a person is more influenced by psychosocial factors than by physical. So, like, just see a person was telling when a person is going into his last days, it is it is more connected, or that person will be more connected with his psychosocial factors than with his physical factors. So just imagine the importance. Like as a person is going to his last days, he will be trying to get connected to his like happiness related to his mental health and the so-called comfortness from his relatives or the parents or the social system which he is more connected with. So those are the areas which he will be expecting more relief, or when all these areas are too much connected to him, then he will be feeling that kind of, or she will be feeling that kind of reliefness or that comfortness, than though the person was in a very great pain scale. So that much a person is more influenced to his psychosocial factors than by the physical factors. So this was an article which I was looking into, and this quoting had made had given some importance in like while I was reading. So I thought to add this also into my presentation, and this clearly depicts like how much the psychosocial is important, especially in a field of palliative care. So by concluding with that words, I wanted to just point out few points why we are saying that much important is. So first and foremost, like just imagine that one fine day, a doctor or some expertise are coming to you and telling that you are having a very serious illness, a very life-limiting illness. So what will be your concern at that spotted moment? What sort of thoughts will you be having? Just share, please. Do you get my question? What I was asking, or should I need to repeat it? Renuka.
There will be a tension.
Okay. So you'll be having tension while when one expertise is coming to you and telling you that you are having a very serious illness. Okay, you will be
And
more
fear,
anxious.
tension and fear.
Fear will be having. So regarding what sort of fear? Is it regarding your health or anything else you will
Regarding
be
the,
having?
regarding the death, because of that severe this thing, I'm going to miss my family and everything. My time is there up now. I'm going to go.
Okay, like so mostly it will be like fear of death.
Yes.
Okay, fine, fine. Okay, thank you, Sharmila. And like, I would like to have a response from others too. So, what concerns or what feelings will you be having when someone is coming and telling you, like a doctor is coming and telling you, oh, so I'm sorry, like you are having this kind of serious illness. Okay. Veronica, you will be feeling lonely, Veronica. Is it? Yeah, come on. We are coming to say something, Veronica. Pardon? Can't hear you.
Renuka, are you trying to tell us anything? It's not clear, Renuka.
Okay, you can share your thoughts in the chat there. Veronica. Okay, Veronica, you were coming to say something. Sorry?
Okay, if it's not clear, put your thoughts in the chat box.
So, yeah, like worry about family, especially children if they are still young. Okay. So I think you are more connected to the family members and you will be so worried about your, thinking about the future of your children. Is it? Okay. And Purva, you will be having financial stress. So, actually, yeah, you want to enjoy the last days of my life. Okay, so how you are planning to enjoy the last days of your life? Can you please explain on that? Roam around, okay. Okay, great. So most of them are saying like will be worried, will be stressed, will be anxious, will feeling that lonely feeling. Also like anxious and stressed about the thoughts regarding your dear and your ones. Like anything else except these points, like anything what you anyone want to share other than this? Okay, worried about children. Yes, Purva. So most of them, I think, like most of the comments was regarding like your thoughts regarding these so-called social people whom you are so much connected, and yeah, because of that, you will be having that psychological kind of stress and anxiety. So just imagine the patients who are coming to you, the palliative care patients who are coming to you. So they are hearing about their illness 10 times a day. That is, this is you are having a very much vulnerable illness. You are going to a very very hard times of the days. You'll be having very like hard pain again as moving forward. So such kind of physical as well as mental stress only they are having. So which they need some sort of psychological support. Giving a physical support alone cannot work for them. So which clearly shows or explains that they need some kind of mental health supporting systems. So, because of this, we can clearly say that yeah, it is important. Psychosocial factors, it is important in palliative care setting. So, this is what I have explained on the first point. Coming to the second point, understanding the factors related to a patient's quality of life is essential in providing appropriate care. So you are a person who are having that great mind of giving proper care for the palliative needed patient, a palliative care needed patient. But if you needed to provide a proper care, you wanted to know what kind of care that the person needs, like in which area or the which factors that you have to work on. For that, you need a correct understanding about the patients, like in which area is this person's quality of life is going to get improved. So that particular areas or that particular factors has to be properly assessed by you. So you need a clear cut information or clear cut picture regarding your palliative need patients, psycho as well as social as well as spiritual aspects. And the third point explains that a palliative care is a life affirming approach, and it is like a team effort. So you alone cannot. Maybe when you reach a point where you need some kind of informations or motivations or some kind of opinions from expertise. So during those times, you have to connect a psychologist or you have to connect a social officer or someone who is very much expert in that, so that you can give a proper care for a palliative care patient. So it is a life affirming approach with a multidisciplinary team effort. And the fourth point explains that psychosocial support helps in reducing the level of actual and perceived stress and in preventing the adverse psychological and social consequences amongst disaster affected community. So there is a difference between actual as well as perceived pain. Like there is an actual pain in due to some sort of illness, but that person is overthinking that pain and telling the pain in a very exaggerated manner. So that is a perceived pain. So there is a lot of difference between this actual pain as well as this perceived pain. So maybe that perceived or that exaggerated pain will be due to his stress. Maybe he will be thinking more about that disease, or maybe like more about thinking about the family. So that pain comes from these kind of factors which is underlined, which we do not know, which we doesn't know, don't know. So for that, we have to again explore like where are the areas which we have to work, and based on that we can reduce that exaggerated pain and make that patient understand what the actual pain is. Okay, so based on all these factors or based on all these points, we can clearly say that psychosocial support is important in a palliative care field to provide a proper treatment. Hope it's clear for you. The slide is clear for you. Should I need to explain more about it, or do you have any queries based on the importance of psychosocial? Response, please.
Understand, ma'am.
Okay, thank you. Thank you, Shamala. So moving forward. Okay. So, a term which we are very, very, very much familiar, but a term which we need to more about, we need to more look into also. So, everywhere when we go ask someone, they will say that, yes, I am having pain. But the pain, what we understand is not the physical pain, but there are some other components which is interconnected in this so-called pain. So when a person says about pain, it is not only the physical factors that explains pain, but some other components, which is the psychological, socio-economic, and spiritual. So what is total pain? Total pain reports his or her subjective pain on the pain scale. It is important to remember that the physical pain reported by a patient is compounded by his or her current life circumstances. So here I can explain you the story. So we do have a case here of a 27, 28-year-old boy who is hemiplegic. He had fell down from a tree and got hemiplegic. Explaining about his family, his primary caretaker is his mother. His father has already got expired few years back, and there is no other siblings for him. And he got registered to a Pallium India, and I was taking like he was under the palliative care treatment from a hospital. So during that time, like whenever we ask him about how much pain do you have pain or how much pain does he have, he says that he's having a very high pain, and that pain will be like 10 out of 10. So we have tried multiple medications for that pain. Like we have been trying paracetamol, tramadol, like even so-called narcotic drugs. Also, we have been trying. But however, this pain is not getting reduced. So the doctor has asked the social officer to just go and have a communication with him and explore like what is his concern. So the social officer went and had a good communication with him. But he was a person who is very much introvert and stubborn that he doesn't open up his thoughts. So that sessions took, I think, around 3 4 days to have a good rapport with that social officer. And gradually, this patient opened up that his only concern is about his mother. So he was still in that I am 27, 28 year right now, and his mother is around 58 years at present. So this is the time where I have to take care of my mother, but the karma has did like the mother has to take care of me. So what is the purpose of I am living right now? Does like if something happens to me, who will take care of my mother? Than lying like this, it's better to die so that at least my mother will be getting a few physical rest. So we understood that the pain what he was telling is not because of the physical pain, but because of these kind of thoughts which has been disturbing him all the way from that point of accident. So here, just providing medication, does this kind of pain works? Will his physical pain get reduced, or the pain what he was telling here is only about the physical about his physical pain, or the disturbance due to his sleep? What do you think? The pain what he was explaining is the pain is the actual pain or the exaggerated pain?
Exaggerated pain.
Yeah, and why from where this exaggerated pain came?
He's thinking all the time that what you have to explain, like what will happen to his mother after
Yes,
he gets died, or a financial problem, how she will handle. No
yes,
one is there after me. Father is already not there. She will be all alone.
yes,
So all
very,
that
very.
stressful, scary, fearing, all that was.
Yes, yes, yes. So it clearly says that the pain what he was having was not his physical pain, but the pain which was coming from all these kind of thoughts. So here the total pain will not work only while only looking to the physical aspect. So the total pain has to be assessed in a manner by looking into all the four dimensions. Only then we can say that yes, he is having the total pain. Is it clear or having any doubts in this?
Clear, ma'am.
Okay. So moving forward. So basically, here the physical pain can be assessed through pain scales, like asking the patients about what sort of pain he or she has, or what kind of pain it is, what will be his value, like out of 0 to 10, how much is his value and all. But what about assessing the psychological pain, the socio-economic pain, and the spiritual pain? In those areas also we need some kind of tools to rectify or tools to identify the pain factor. So for that, we have an assessment called psychosocial assessment. So this is an assessment which we use to take to know or to understand the so-called areas or factors which is affecting this patient in pain. So the aim of the psychosocial assessment is to identify what is his problem or what is his concern or in which area is the problem or the pain relies. And from that, we're trying to create a very good well-being for the patient as well as for the family. Because just looking into the patient doesn't work. He or she is the one who's living in a social phenomena. Like he is connected with some other areas like his family or relatives or peers, whoever it is. So focusing only on patient doesn't work. So we are taking the well-being of patient as well as their family. And by the assessment or by taking the assessment, we are trying to identify the problematic area. So, what is this assessment? This assessment is actually an evaluation of the patient's mental health as well as their social well being. So, we are going to evaluate the patient's mental health as well as their social well being. So, how this evaluation, how does it work? So there is no instrument or there is no kind of machines to understand the social well-being and mental health. The only tool what we have is communication. So by communicating, by probing, by asking the patients, and through that collecting the information only gives us the valid data to understand about the problems. So first we are going to collect information from the patient as well as from their families or whoever the areas where they are connected. And after collecting those informations through communications, we are going to identify what is his or her problem is, and by that we are trying to honor their strength. Like they will be having some sort of positive areas as well as negative areas. Positive and negative means like strength and weakness. So by collecting the informations we have identified, yeah, this is the problem zone, and after that we have identified, okay, these are the areas where he is lacking or where he is more weakened to, and some areas will be there where he is strongly connected or he is having a he will be very much motivated when he comes to these areas, and based on that we will be strengthening these areas and understanding this weakened part. If needed some resources, for example, if the weakened part is a financial area, then we will be trying to collect the resources for that financial areas, so that it will be getting strengthened, and thereby also identifying his need. So just if a person is asking for like some sort of he needs something but we are giving what we likes, will that match? No. So we have to identify what he needs, and based on that, the resources has to be provided to him. So, so psychosocial assessment is basically the evaluation of mental health as well as a social well-being. For evaluating, we need to get informations. So first and foremost is collecting the informations from patient as well as from their families, and based on that, we are going to filter like what is the strengthened part, what is this weakened part, and after that, we will be identifying what the core area, like core problematic area is, and based on that, if anything has to be strengthened, then that will be added, or if anything has to be more motivated, then will be having, or if any resources has to be added, then that also will be adding based on his or her needs. So did you get an idea of what psychosocial assessment is and how we are going to do psychosocial assessment? Is it clear? Yes or no? Yes. Okay. Thank you. So moving forward, so we were telling there are some areas we have to focus on, like the informations have to be collected. So based on the collection of informations, we have separated few areas, and these are the basic areas. Just remember, like these are the basic areas of access. So on these basic areas, like again, we are classified like general, patient and family overview, insight, as well as family structure and dynamics. So coming to the general aspects, what all informations are collected? Basically about the patient and so her family, like whether he or she knows about the illness, like the insight will be checked, family structure, socioeconomic status, environmental access, psychological distress, spiritual impact of illness, interventions and plans. Okay. Should I need to explain any points? I think it will be knowing to everyone, like each point will be is understandable. Should I need to explain any points in this?
Please respond. You need more clarification?
Should I need to explain any point? No, okay. Regarding, okay, Veronica, do you need any point to be clarified?
No, ma'am.
Okay, thank you. So, patient and family overview. So there we'll be taking the basic demographic details, like what the patient's name, age, gender, occupation before the illness, after the illness, who will be taking care of the family, who's the primary caretaker of the patient, and does they have any other source of supportive systems. So such kind of basic demographic details will be taken. Then occupation, yeah, as I said, like before and after illness, who's the primary caregiver and what sort of relationship the patient is having with this primary caregiver. Okay, then going to the insight. So what actually we are looking in this insight? So what do you mean by insight basically? So what is this insight? What do you mean by insight? Understanding. Okay. So yeah, thank you. So here, the meaning or the like what we are trying to know about insight is how much insight do they know about the diagnosis, like the patient as well as their family. Does they know about the insight of the illness what he or she is having? So why do we check this insight? Because basically yeah, about the disease, yes, exactly, Veronica. So basically, when you go to a hospital, the patient, I mean the doctor will be going through the papers and all, and will be speaking to the patient or to the caregiver directly. They won't be like, some will be clarifying or verifying whether he or she knows, but some won't be verifying, like they will directly speak with the patient about the illness, but the patient may not be knowing. So just imagine a person, a patient, or 60 years male patient who is cancer on stomach, who doesn't know about his diagnosis, has been sitting in a front of a doctor, and the doctor was directly saying like, do you have any pain right now, or do you know the stage of the cancer what you're having? So just imagine the about like what reaction will the patient will be giving at that moment. Only he's knowing that he was having this kind of disease. So whoever, like whatever time what you're going to deal with the palliative care patient, make sure that he or she is aware about their illness or not. If he is not aware, then the communication should be in that kind of manner. So the insight of the patient as well as the family, maybe the family members also doesn't know. Like for example, if the patient is having cancer and his wife is not knowing what the patient is having. So you have to be aware, or you have to check that too, like whether the family members also aware about the illness. And not only the diagnosis, but the prognosis too. Like on what stage or what scale is this person's illness right now? So that also has to be like assessed, like in what depth the knowledge of illness the patient as well as the family is having, and also like whether he or she knows about palliative care. So you are sitting as a palliative care faculty, and you are like giving messages or education or giving support based on palliative care, and that person was expecting for a curative treatment, what it will be like, there will be a very much clash or conflict will be happening between your reaction as well as his expectations. So make sure that before going into a communication or a detailed palliative care treatment, just make sure that whether he or she, the person who is sitting in front of you, whether be the patient or the family member, is aware about their diagnosis, prognosis, and palliative care. So checking all these three comes under the category of insight. Okay, so moving forward, now we are going to the next area, that is family structure and dynamics. So here we will be checking about the genogram, the family dynamics. Like in family dynamics itself, we will be looking what are the support system, what he or she has, and the history of illness in the family. Okay, so these are the four major basic areas of assessment. I hope this is clear and no need of further explanation. So can I go forward? The next slide. Can I? Okay, thank you. So yeah, so these four slides are a little more narrowed from the general or the basic areas of assessment. There we were looking into the broader areas, but here we are specifically on, we have narrowed few points and specifically focusing on some aspects along. So, physical aspects. So, you will be very much knowledgeable about what we are going through, like what we'll be checking on the physical aspect. Basically, like how much the pain the patient is having. And that pain will be assessed by interviewing the patient. Then coming to the psychological aspects. So here we are going to look into the mental health of the patient as well as their family. So whether he has a history of any kind of psychiatric or any kind of mental health issue, and how the mental health is currently right now. Is he is in a very good mental health to have a good conversation, or to like ventilate, or to tell more details about his illness. So just look whether he is in a very good mental health state or not. Then emotionally, how much he is. Like he's a person who is very much sensitive. Like speaking about any areas will make him shattered and like ventilate all the emotions what he is happy, what he has. So just look whether how much emotional well-being, how much emotional maturity he or she has on psychological aspects. Then comes like anticipatory griefs. So there are people who used to, who even doesn't have any grief, will anticipate it, like I am having this kind of disease, or I'm right now in this condition because I have done something to someone on that era, or on my past, like looking back to my past life, I had done some mistakes which I shouldn't do. So because of all those things only, this kind of thing have happened to me. So in this manner, these people will be anticipating. So check whether they are having any kind of anticipatory grief with them. Also understand the pattern of their coping. So we all individuals will be having some sort of manner in coping our stress in life. Do we? Okay, so basically, my coping mechanism will be like if I am stressed very much, I used to have a very good special dishes to release my stress. So, or like used to like to hear few like good like melody music, which will obviously will be releasing my stress amount. So same likewise, all the human beings, like all everyone's will be having some sort of way in which they cope up with their emotional or with their mental health manner. So just understand like how the patient who's sitting in front of you is coping their stress life or coping their this kind of conflicts that is happening inside them. So just look into all these 4 points while you're looking taking an assessment on the psychological aspects. Coming into the socio-economic aspects, yeah, the basic one, which is food, clothes, and shelter. Whether the person is having these basic three necessity things in their life. Second one, who is the breadwinner of the family? Like maybe in most of the four-member family, like when we look into a nuclear family, if the father or the yeah, the father or the husband has got affected with some sort of life-threatening illness, then obviously that earning member or that like supporting system will be collapsed. So just look into who is the breadwinner of the family on that particular patient's home at present, as well as who was the breadwinner earlier too. Then is there getting any other source of income from any of their relatives or any of their supporting systems, maybe like local support systems, or it may be some mentors or sponsors who wish to support them. Like so, just explore like from where the family is running right now, and does there any other support system to help this family, and also like debts, like is there any debts for this family, and this social support also includes like government schemes. So we are having very much good government system in Kerala where so much kind of schemes are there. But the bad point is like no one is aware about the schemes, different kind of schemes. So for cancer patients, there will be cancer pension for them. There is a caregiver pension for the caretakers who are taking or looking after this patients. So there are so many schemes, but no one is aware about what all schemes should be given or should be is available for each kind of patients. So just explore like is they are connected with any kind of government schemes or not, and also they are getting very much good support from the local financial systems, the local government system too. And at the end, the education of the children, like most of the cases we can say that the education of the children will be in a full stop point, like due to the financial condition of the family, the children they individually or they personally will take a decision like, okay, I'm going to quit my education part because of the financial state of my family. So just explore like is the beneficiaries children are getting proper educations, or they have stopped or not. Okay, so that comes under the socio-economic aspects. Then coming to the spiritual aspects. Okay, here like the spiritual aspect here, what we are going to explain is not something which is about the religious aspects, but just looking like how much the person is connected to, like to which area the person is connected. That may be to his own roles and responsibilities in life, or maybe to the nature, or maybe to the beliefs what he is what where he is grown up, or where he is imprinted to, and like likewise like where the spiritual areas or spiritual aspects gets connected with. So that connection is where we are trying to explore, not only focusing on the religious aspects. Yeah, for some people their religious aspect may be their spiritual area. So just trying to understand where the patient is connected, and where are their strengths and comfort comes from, and the meaning of their life, like for everyone who are going through this kind of life threatening or life limiting illness will be having the question of why I'm living, as my life has gone through this kind of things, or I am in such kind of situations, why am I leaving? Like, why I'm leaving in such kind of way? It's better to end my life. So for them, try to understand, try to explore why they are saying like that. Have they lost the meaningness in life or the joyfulness in life? Then try to find and seek or provide them that kind of meaning within that limitations. Also, they will be saying like, okay, my hope has gone. I doesn't have any hope right now. So within that limitation, try to explore what is their hope, and do we can able to fulfill any of that. So such kind of, in such manner, we are trying to access as well as fulfill their spiritual aspects in life. So these are the four dimensions where we are going to collect information in a very specific manner, and these all information has to be covered up while taking a psychosocial assessment. So, do anyone have any doubts in this points? If then we have to clear this right now so that we can move forward. So this is the point which we are majorly focusing on and majorly collecting while doing a psychosocial assessment. No. Okay. I think everyone want to finish this class faster so that no one is having no doubts, I think. Is it like that?
If you need any clarifications on any aspects, you can ask to the faculty. Was everything clear? You want to discuss with the faculty for regarding any topics that we discussed in this session?
Okay. So I think everyone is clear till now. So by this, we are going to conclude the psychosocial aspects, what it is, how it is, how we are going to explore, and what is the psychosocial assessment tool, and what we majorly focuses on, and what are the points which we collect or the informations that we collect through psychosocial assessments. So I hope like it is clear for everyone. And now next step is like some few components, like here we have discussed about the genogram and family overview and all. So some components which comes inside the psychosocial aspects only we are going to just find it out. So I think it's clear for everyone till now. So I'm just moving forward. Okay. So did anyone saw this term in family structure like genogram? So do you have any idea what this genogram is?
No, ma'am.
Okay. So yeah, so why you didn't ask me on that time that you didn't get this genogram term? Family tree, okay. Nasima. Okay, so I think few of them know what this xenogram is. Okay, so basically, this is a graphical representation. So we were telling about family details, family dynamics, how many members are there in a family, how much they are connected and all. But these details, these paragraphic details are explained on a single screenshot or in a single statistical or on a pictorial representation that is explained. So just by looking at that statistical or that graphical representation, we get a detailed information about that particular family. So that representation or that pictorial representation is known as genogram, and this was introduced by Murray Bowen. So in this genogram, what all informations are explained? First and foremost, the structure, like the structure of the family will be completely explained. The dynamics, like how much connected they are, like inside the family the members are, how much connected they are, like the strengths, maybe the connection will be in a very good connection or a weak connection, so how much the strength is, and the resources what this family is getting. So all these details are explained in a genogram. Adding to that, we also explain their name, their age, their education, and their occupation, as well as their emotional relationship. So, yeah. So these are the symbols which we are going to use in a genogram. The first square, like the square represents the male, the circle represents the female, and together connected by a straight line explains that they got married. Okay. And in this marriage, like in this family, if a slash comes in between this line, we can say that the family or the husband and wife got separated. Okay. And if this slash is a double line, we can say that they got legally separated, that is, they are divorced. Okay. So square is a male, circle is a female, connected by a straight line, tells that they got married. And if a slash comes in this straight line, that means they are separated. And if this slash is a double line, it tells you that they have been separated legally, which means they are divorced. Okay. So this right picture, this explains that a straight line and a dotted line for a circle. So the circle means that it is a female. Okay. So this is an adopted child. If a child is represented in this manner, we can say that it is an adopted child. And it is like these, it can be circle as well as a square too. If it is a square, then we can say that that particular boy is an adopted child. And in this picture, this is the particular girl who got adopted. Like someone was, yeah, Muskan, do you want to say something?
Please tell us, Muskan.
Or you can put in the chat box. Like if you are facing any network issues, you can put in the chat box. Okay. So moving forward, like here, this is a dotted line, and since it is a square, we can say that is a male. So this here, the child is comes under the foster child. So you know what the foster child is? Okay, like anyone aware about who's called as a foster child? Okay, so foster child means he or she can be taken care of till the age of 18. So adopted child means they have taken that child legally, and that particular family or whoever the guardian is should take care of the child throughout their life. But coming to the foster child, here it explains that that particular child will be taken care of by the guardian till the age of 18. Okay, so that is the difference between the adopted child as well as the foster child. And here this triangle represents that she's pregnant, and this one stillbirth, miscarriage, abortion, and twins. Twins will be represented from a single point, like from single point, either to female or to male, or one female or one male. Okay, so these are the symbols which we use in a genogram. Ready? Can I move forward?
Yes, ma'am.
Okay. So this is how we explain the emotional or the strength of their relationship, like the emotional or the mental attachment between each other. So the first one says that there is a normal or a plain relationship between the male and the female. And the second line says that it's a dotted one, and it explains that it's not that much intimate or that much weakened, but yeah, a high by kind of relationship. And the third one says that yes, they are too much connected with, like their relationship is very much intimated. And the fourth one says that yeah, some kind of conflict is happening between them, and some sort of hostile relationship is present in this relationship. And the fifth one says that it is a violent relationship. There will be some sort of abuses even in this kind of relationship. So you just focus on this uh, box rather than this, because if you are learning both together, we'll get confused. Just focus on this one. Like the first one is a plain one, second one is the high-by kind of relationship, third one is an intimate one, fourth one is some kind of hostility present, and fifth one is a violent one. Okay, so this is how we explain their emotional relationship between each other. Okay, so based on this and this slide, any one of you have to explain this genogram. So this is called a genogram, and here, I will give small hints. Sindhu is a patient, and since she is a patient, we have been denoted her with several multiple lines in the inside the circle. So yeah. So anyone of you kindly explain the genogram of this so-called Sindhu patient, please? Okay, can anyone give a try on this?
What, ma'am?
So this is the genogram of Sindhu.
Hmm.
So you will be explaining this genogram.
Can I?
Sure, sure. Please.
This Kumaran and Laila is already expired. Laila, Kumaran, Mohan is expired.
Okay.
Saji, 60 years old Leela is there. She's a homemaker. Raju, coolie worker who was there, he's also expired. And Amal, Vimal are their cousins. Sorry, I could not get this connection now.
Okay.
No, Saji and Sidhu is a husband and wife,
Mm-hmm.
and their children, two children are there, Amal and Vimal.
Okay. So like why it is represented like this?
What this? They are the twins.
Yes, yes, yes. Good, good. Okay. Okay. Thank you, Sharmila. Anyone
I
else?
think one more that Raju was his first husband who expired, and he had one son from that.
Yes. Yes. Yes.
And he get married with the Sajida, and then she get twins.
Sure. Good. Good. Good work, Sharmila.
Yeah, thank you.
Okay. So, anyone else who want to give a try on this genogram?
Darshan, can you?
Raji's mother and father.
Okay. Sindhu's parents are Mohan and Leela. Sindhu's mother is 60 years old and her father has passed away.
Okay. Come on, Darshan.
She's initially married to Raju, who's working as a coolie worker, and she's got a 16-year-old son who's in 11th standard. After which it looks like she married again to Saji, who's a mason, and they both have a twins, Amal and Vimal, who are in class 8. So basically Sindhu has got support from her husband.
Okay. I think you left out Kumaran and Laila, I think.
I'm sorry. I'm traveling, so it might not be very clear.
Okay.
So Kumaran and Laila both have passed away. So
Sure.
basically,
Okay.
Sindhu has got her mother and her husband to support the three children.
Okay. Okay. Thank you, Darshan. So yeah, so I will give a small tip in this genogram. So whenever you're explaining a genogram, it is better to start from the patient, or here when we explains, it is better to start from the Sindhu, because our focus or our patient is Sindhu, and while explaining a genogram, like we can start from that particular person. So coming here, Sindhu, 40 years female, is the child or is the daughter of parents Mohan and Leela. Mohan got expired and Leela is 60 years old and she's a homemaker. Initially, Sindhu got married to Raju, who was a coolie worker, but he got passed away. And in that relationship, they had a child who was 16 years old, and his name is Sharan, and he's studying in 11th standard. Then later, she got married to Shaji. Shaji is the son of Kumaran and Laila, both got expired. And in the relationship with Shaji, Sindhu has two twins, who is Amal and Vimal, studying on 8th standard. Okay, so when we start from Sindhu, it was very much easier for us. So than explaining each generation, that is the first, second, and third generation, it is easy to explain, or it is easy to convey a family history when we start from the patient. Okay, so I'm going to add a little more masala to this genogram by including the emotional connection of Sindhu with the family members. Okay, so this is the same genogram, but few members also got added, and their emotional relationship also is explained in this. So yes, who can explain this genogram? Anyone? Angela?
Somebody please volunteer.
So who can come up and explain this?
Veronica, can you?
Hello.
Yeah. Come on,
Hello, ma'am.
Shamala. Yes. Go ahead.
This Sindhu, who is 40 years old, she had Sindhu's parents are Mohan and Leela. Mohan is expired. Leela is 60 years old. Mother, who is homemaker. Sindhu had three friends. Hello.
Sindhu had?
Three friends.
Is it friends or siblings?
Green is siblings. Sisters, this are.
Yes.
Ma'am, I cannot hear your voice properly.
I'm not audible enough?
No, now only, I don't know.
Okay, so can you hear right now?
Light. Sindhu had three siblings. Shar Indra, what's that? Indra?
It's Indu.
Indu, who got married to Mani.
Yes.
Then 38 years old Brindu, who got married to Ravi, 43 years old driver. Then again, one more was Sarath. Sai something. I'm not getting cleared also that.
Which one?
Like
Which one? Like
Sairath, third one. Then Sindhu got married to Raju, who was a coolie worker.
okay.
And he expired, so he got married to Saji Manshan,
Yes.
whose mother and father both expired, that Kumaran and Laila.
Yeah.
And his two brothers,
Is it two
Saji's
brothers?
Subhash is a brother of Saji,
Yes.
who got married to Veena.
Veena, yeah.
And Veena and Subhash is having conflict with this, not in good relation with Saji.
Yes.
And Saji is not in good relation with Samarth or Sainath.
Sharad. This
Sharath, yeah. He's also not having good relation with Sharath.
Yes.
And from Saji and Sindhu, they got both two children. Those are the twins.
Yes.
Amal and Vimal.
Yeah.
So Vimal is having tutti futti, this thing means having slight relationship with Sarar. But
Okay.
Amal is not having any this thing.
Okay. And what about the green darkened ones?
Ma'am, I'm not getting your voice. Yeah?
Like, what about the darkened line, like green line?
Green, no?
Yes.
They are having good relations, like.
Okay, so that shows that they are having a very good intimate relationship between each
Yes.
other.
Yes.
Okay, fine. Okay, thank you so much, Shamala. Can anyone else do? Veronica, what about you? Can you give it a try?
This patient Sindhu is 40 years old. She's a mother. Leela and Mohan is died. And she's having two more siblings, Indu, and she married to Mani. And the Bindu, she's married to Ravi. And Sindhu and Bindu with they got good relationship. And Sindhu married to Raju and he died. Then they got one child of Sarath named Sarath. After dying of his first husband, then she married to Saji Mason. And Saji Mason, his father and mother is died, who's Kumaran and Leela. And Saji and Sindhu got two twins children, Amal and Vimal. They are studying in 8th standard. And Saji got his brother Subhash, who married to Veena. And Saji and Subhash and Veena, they got conflicts in each other. And Saji with the Sarath, they also got in between this conflicts is there. And Sindhu, the green light shows in Sindhu, Bindu, and his Sharad, they have a good relationship, friendship. And the line which is the Vimal and between Sharad, it's like they are abusing each other because of step relation maybe.
Okay, okay. Thank you so much, Veronica.
Yeah,
So,
thank you.
I think there are two more lines. One between Leela and Sindhu. One straight line is also there. Like,
Yeah.
can you see that?
Yes.
Okay, so this straight line, what does this means? Anyone? So this shows that they are having a plain relationship. Here.
Normal.
Yes, plain or the normal relationship. And also the same line can be seen here also, like between Shaji and Amal as well as between Shaji and Vimal. So there also the father and the children are having a very plain or the normal relationship. Also, like why all these members are in this circle? Any idea?
I guess they are closely associated with the patient.
Yes, that is also right, but
As family members, nuclear family members, I guess.
yes, less. So all these members are living in the same home or they are all together, living together. Okay, so Sindhu, a husband, Shaji, their children, Vimal and Amal, and Sindhu's first child, Sharan. All these are living together in a home. Okay, so hope the genogram is clear to everyone. Is there any doubts regarding anything? Further explanation or anything is needed? Anyone? Okay, so can I move forward?
Ma'am, I'm getting less sound.
Okay, just a second. Nice. Okay, what does two dotted lines mean? Okay, so dotted lines means there is no that much intimacy between those two. It's just like a hi-bye kind of, or very mere communication is happening between these two people. So coming to the genogram, here says that Vimal and Sharad is connected, but not that much intimate one. Okay, so was I clear, Dachin?
Yes, thank you.
Okay, okay, welcome, welcome. So Shamala, is it audible right now? Can you hear me?
No, ma'am, very low sound.
Okay, like, is this same for everyone, like a low sound?
Sharmila, you might be having some network issue from your side.
It's clear. Okay, okay. Okay, so I think I can move forward right now. So till now we were explaining about the internal connections or the pictorial representation of the family members. But now again we are going to explain how the patient and the family is connected with the society. So that is called as, that pictorial representation is called as echo map. Okay, and this echo map was introduced by Anne Hartman. Fine. So here we will be explaining how this patient and their family is related with the outer world or their larger society. And those explanation will be shown in an echo map, or that snapshot view is called as echo map. So here we are going to explain like how much they are in connection with patients, other family members like relatives, other organizations, associations, etc. Okay. So these organizations are outer the social network comes, like the health services will be there, the neighbors, the volunteers, their workplace, their schools, clubs, government services, friends, religious institutions, community services, etc. Okay. So the same thing there is no much difference, but only thing which we have to focus more here is the arrows. Like from where to where is the energy flow is going on, like the frequency or the wavelength is shown towards which area. For example, here I can say that the both arrow is represented, one towards the male or the husband of the family, and secondly towards the colleagues. So this shows that they are having a good energy flow, or they are connected each other, and their connection is in a very plain manner or in a normal relationship. So here we have to focus on from where to where the energy is being flowing. So that arrow shows, or that more focus has to be given to the arrows. To which point is the connection is showing? Is it from the patient to the like A or B group, what it is, or from that group to the patient or the family, or it is in a both way or not? So yeah. So who can explain this? So it's more simple than the genogram. Just focus on the energy flow or the arrows. So who can give a try on the echo map?
Yes, ma'am.
Okay, come on.
This patient is there. Patient, lady patient.
Yeah.
Husband is there, and they got two children, one boy and one female, girl
Oh,
child.
yeah, good. So that is the
Patient
genogram, or that is the family picture what we got.
genogram.
Yes. So now we are going to explain this
Patient,
genogram with the outer world or the outer society.
yeah, patient is the mother in that family.
Yes.
From self-help group, there is a positive this thing, approach is there to the patient.
Yes.
From the church, that means she's a Catholic. From the church and from her side, very strong and strong, powerful, positive approach is there.
Okay. Is it only focusing to the patient or to the whole
No,
family?
it is sorry. It is for the full family.
Yes, yes, yes. So just focus that also. Like the arrow is shown to the whole family. And it is a very
Family.
strong bond, which is vice versa also.
Yes.
Okay,
Yes.
good,
From
good,
the
good.
panchayat member, it is a very weak approach, weak support, or weak approach is there. And from the neighbors, it is stressful, hostile environment to the full family.
Yes,
And
yes,
from the
yes.
panchayat, it is very weak to the family
Okay, yes.
support. And from the neighbor, it is very stressful to the whole family. From the volunteers, it is from the volunteers to the family, it is there, but not from the family to the volunteers.
Yes.
Positive approach is there. Youth organization to the girl child, and vice versa, like from girl child to youth, it is a very strong and positive response is there.
Yes, they're having a very intimate one, right?
Yes. From school also, from school to the girl child, that is the supports, positive support. From friends to both the children.
The male as well as the female.
Yeah, male child as well as female child, both from both positive approaches there. And from college to that, I think that means that boy is studying in the college. He has whereas girl is younger who is going to the school, and boy is going in a college. So from college to that boy child, very strong this thing is there, vice versa.
Yeah.
Positive. Public health center to the patient, it is very weak support and approach is there.
Yes.
And colleague to the husband, to the patient's husband, it is good positive approach is there.
And it is vice versa too.
Yes, it is vice versa.
Okay, okay. Very good, Sharmila. And thank you so much. Okay, like anyone else want to give a try? Okay, is it clear for everyone? Is there any doubts in this part, like the echo map part? Okay, so can I move forward? Okay, thank you. So yeah, we are going to the end of the session. So till now we were explaining what the psychosocial is, how to explore the psychosocial factors, and why it is important, or what all things has to be focused more on that part. Okay, sorry for that. Okay, yeah. So till now we were explaining what the psychosocial is, how it has to be evaluated, what all factors are there, and the genogram or the echo map. All the factors has been explained. Okay, so coming to the end of the slide, we are going to express or tell about who is a caregiver. So till now we were telling about their patient and their family, but most of the time we can see that mistakenly or like knowingly or unknowingly, we used to call the caregivers or the families as bystanders. So for that I have to say is that never dehumanize them, because we all comes under this category called caregivers. So do you feel or do you believe that you are a caregiver right now? Do you think so like that? Comments, please. Do you feel like you are a caregiver right now? Or do you will become a caregiver as times goes? Yes. So this is a small definition actually, not a definition but a quoting explained by Rosalind Carter. So she was telling like there is only four kinds of people in this world. One will be who have been caregivers. Second category of people will be the ones who are currently caregivers. And the third category of people will be who needs a caregivers. And fourth category will be who will need a caregiver. So just telling out simply that we are caregiver and we will become a caregiver or we will need a caregiver once in a like somewhere in a point in our life. So just respect them and never dehumanize them by calling them as bystander, and acknowledge their feelings also, like their importance, their mental health, their social factors, their spiritual aspects. So these all points has to be assessed and acknowledge that also. Okay, so yeah, so these are the small interventions or the plans which we provide by after assessing their psychosocial factors of our palliative care patients. So the interventions what we provide here are providing them informations about or providing educating them about the illness or the facilities needed for the patient at that moment. Like educate them, providing them counseling, following also, like just giving the solutions never works. We have to keep on regular follow-ups whether that solution is getting benefited or not. So following on that, bereavement support, rehabilitation support, facilitation support, liaison. So these are the small pocket of like small interventions what we used to give provide to our patients based on their needs. There are few others also, like based on the needs what we are met with the patients. So moving forward. Okay, so Hmm. Last part, case study. So this is a small case study. It's a 56-year-old lady. Her name is Mrs. A, and she has been diagnosed with CA breast in 2016. She has done mastectomy and referred for pain management. She was looking very anxious and had no idea about what palliative care is. Also, she has some comorbidities, which includes diabetics since 12 years, coronary artery disease, and also a fracture on her leg after a fall on 2019. She's a widow, and her children are having a very hostile relationship with her. Also, she is living in a rented house. Hello. So, can you please tell the physical aspects of this particular lady? Like, what all concerns will she be having based on the physical areas? Anyone, please? There, difficulty in carrying out daily activities. Okay. Her age.
Economical tension,
Sorry, pardon.
financial, financial and economically unstable. Like,
Okay, like now we can focus more on the physical aspect. So, be like based on the
okay,
physical
okay.
area, what are things she will be having?
Yes, unable to do her daily activities, like so difficulties in activities.
Okay, yeah. Uh, she has done mastectomy, so any physical issues related to that? Yes, disturbed body images will be there. Okay, loss of appetite. Good. So now we can go to the psychological aspect. So psychologically, what all issues she will be having?
Stress,
Emotionally disturbed, yes. So sorry, Shamila, you were saying something.
stress, like regarding, because she is already a widow and
Okay.
children, they might be
Okay, like
also.
socially disconnected she is, right?
Yes.
Okay. Feeling lonely,
Hmm.
no emotional support. Okay, anxiety. Okay, thank you, thank you. So yeah, now coming to the socio-economic part, here we can raise yes, she's having financial issues. Uh, Adding to
They are
that,
li-
nothing else.
they are living in the rented house, so that also, yeah,
Okay.
that means they are not having their own pakka house.
Mm-hmm. Also, like there
Financial
is
crisis.
no caregiver. Here we can see that she's living alone and there is no caregiver for her.
Yeah.
Okay. Yes. So anything else to be added on the social part? Okay, psychological distress. Yes, we have addressed that. Walking issues here comes under the physical aspects. Based on the again we can go to the next area, that is the spiritual zone. So what are spiritual concerns she will be having? No spiritual concerns? Is it like blaming God? Okay, I think there is no that much comments regarding spiritual aspects, I think. Okay, so anyway, we can move forward. Um, the patient is having physical pain, fatigue is there, lack of sleep, difficulty in walking, body image issues. Coming to the psychological part, isolation is there, the patient is emotionally weak, anxiety about the future, unclear about what the prognosis is, and also like about palliative care, also this person is not that much clear. Also, she will be distressed due to this multiple illness. Going to the socio-economic part, as we mentioned, like she's having a very much strained relationship with this family, and she doesn't have anyone. So that is one of the concerns. She's not been able to go for a job. There is financial instabilities is there. Her house rent has to be paid, but cannot be paid due to no breadwinner, and she also not been able to go for work. And accessibility to hospital also have to be explored, like whether she can be able to go for hospital. And also, as we mentioned, like there is no caregiver and no support system. Coming to the spiritual part, here, like, yes, lost faith in God. So this person will be blaming God, like why everything has happened to me. So due to that, there will be lack of connection with the family, and she will think that there is no significant person in her life to express her concern or express her feelings, and there is no memorable joy because she has been a diabetic person since 12 years, and she had a fall in 2019, and 2016 she had been diagnosed with CA breast. So multiple issues has been occurring for her, so that she's not been able to have like looking back, she's not been able to get a proper, memorable, joyful event in her life. So here, this particular case explained that it's a clear-cut picture of not only the person who's stressed with physical aspects, but says that the psychologically, socially, and spiritually, this person is very much stressed and needs a proper psychological, social, as well as spiritual assessment has to be taken. So, with the help of a psychosocial assessment and by collecting all the informations, we will get a detailed picture about what all concerns the person is having on each aspect. So, with this, I like to add few more points. Just evaluate the interventions what you're having, assess the patient as well as the family, like whether the inputs or the interventions which you have applied is benefited or not. Take assessments in between so that you can have an update regarding the uh, psychosocial area, like how much they got benefited or not. And if you also need a help, like go to the experts and reach out for the help, what in which area you have to uh, modify it. And yeah, there is an art and science in every psychosocial care, just as the medicine. So with this, I like to conclude my psychosocial session. Mm, So, any queries, any doubts about the sessions, or anything which you have to ask, please kindly come up. Hope you got an idea about what psychosocial is, how it has to be assessed, and yeah, how much important it is. So, thank you so much, everyone.
Thank you, ma'am.
Thank you, Shamala.
Okay, then we will move on to the case presentation. I think Rachana is there to present the case. I'll share the screen, Rachana.
Yes, ma'am.
Okay, you can start, Rachana.
Good afternoon, everyone. Am I audible?
Yes, Rachana, you are audible.
Okay. My patient is 76 years old female, having the diagnosis. She's a known case of diabetes mellitus, hypertension, ischemic heart disease, hyperlipidemia, and recently diagnosed with chronic kidney disease.
Okay.
Next, please. So currently she is presenting with the complaints of giddiness, weakness, and insomnia. She is not able to sleep. Next, please. So history of illness. The patient is a known case of hypertension and diabetes mellitus for past 15 years, and she's been taking medicine for the same. Also having hyperlipidemia and ischemic heart disease, and is recently diagnosed with chronic kidney disease and is undergoing dialysis thrice a week, having fistula in left arm. Uh, the patient is undergoing treatment for the chronic kidney disease, that is dialysis thrice a week, and taking government medicine for the diabetes mellitus, hypertension, ischemic heart disease, and hyperlipidemia. So the psychological aspect, the patient shows the concern about not able to being there or attend or enjoy the family gatherings or family functions. The patient is having trouble sleeping, feeling of worthlessness. The patient shows concern about being the burden to the family members and feels guilty. The medication that the patient is taking, that the tablet amlodipine 5 mg once a day, tablet chlorthalidone 5 mg once a day, tablet metformin 500 mg BD twice a day, tablet glimepiride 2 mg once a day, tablet ecosprin 75 mg once a day, tablet clopidogrel, tablet sorbitrate thrice a day, and tablet atorvastatin 20 mg once a day. So the main concern is the patient is having the weakness, patient is not able to sleep, and patient is having stress and depression because of all the comorbidities that she is having. Summary: the patient is having trouble sleeping, shows anger towards God, and feels guilty towards family and self, and is having hard time to cope up with the stress. Patient says after that she feels better after talking and expressing her pain. Patient is very cooperative and shows interest in exercise and talking. The only concern is that patient is unable to sleep properly. She overthinks everything, and she is not able to sleep. And the second thing is she feels guilty towards herself and the family because of the comorbidities, and she thinks that she's a burden to her family financially and also emotionally. So as a CHO, as a caregiver, how can I make her feel better and understand and cope up with her stress?
So,
Thank you.
Rachana,
Yes.
so your concern like how to help the family as well as the patient, like with the cope with the
Yes.
stress, right? Okay, so based on this session, like what do you feel like which all areas we have to focus, like based on the psychosocial aspects?
Ma'am, the family has to cooperate more. Family has to understand her better, her situation. The thing is, as the other case that was shown, she lives alone. Her family is not there with her.
Okay.
So
Yeah. So
So
others,
she,
like, what do you feel like? Put your inputs to, like, how can we help this family, or also like how, what all things, what all interventions has to be added to this particular case. Anyone? So, like, do you feel like this particular person is psychologically disturbed?
Yes, yes, of course, ma'am.
Yes. So here, like it was mentioned, like she's the one who used to have like increased thoughts. Like she's an overthinking person. So basically, like we have to figure out, like, is it this overthinking comes from an anxious part. Like, is any underlying anxiety issues are there or not? If there is, then we have to go with the psychiatrist and follow up, like if there is any anxiety diseases or illnesses there or not. Also, since she is an overthinking person, she will be always thinking about, like, about her life, like about her future, like since, like, as days goes, how much she will be able to cope up with, or she will be having a stressful pain on the coming days, like how her death will be. So all these points is making her get more stress, which is affecting her physically too. Like because of that, she is getting disturbed sleep, and which is again gradually going to or affecting in a physical manner. So first and foremost, we should have a very proper, good counseling session with the patients, and should figure out, or to like make a guidelines of what all problems or what all concerns she is having. And based on that, we have to plan an interventions. Like if it is a counseling, then we have to go over with the counseling. Or if it is a psychiatrist facilitation, then we have to go over with this psychiatrist facilitation. Also, we have to look into the family too, like how much they are aware about her condition. Am I right?
yes, ma'am.
Yeah. So we have to go and like check whether, like, how much the family is aware, like aware about her, or does they are being able to understand or accept her pain and her this kind of like thinking process patterns and all. And later we have to provide them also a session based on the conditions, and also we should understand the concerns from their side too. Like they are also becoming stressful by taking care of her, and does that makes the family also in a psychologically stressful manner. That also has to be explored, and based on that, a session has to be taken for them too, and educate them, like convey them about what all disturbance will she be having as days goes on. So I think by through proper communication, by through proper exploring about the concerns, and by giving them a proper ventilation, maybe a good area for ventilating their emotions and thoughts will itself will give them a very good like relief, mental relief. I think so. So if that has to be, then take steps for that, and thereby give them a proper interventions, basically focusing on the psychological health as well as connecting more with the family and making a very good social atmosphere. So all these things itself will make a very good change in her overthinking process, which will obviously will be helping her in a very good sleep. So anything else also should be added by anyone? Can put your outputs too, like is this also can be added or not? You can share your thoughts too, please. Anyone? Okay, anything else has to be added? Anyone? Or else we can wind up the session, I think so. Anything has to be added on? Anyone, please?
No, ma'am.
Okay, so Rachana, did you get any points for your intervention part for this particular patient?
Yes, ma'am.
Okay, thank you. So then I think we can wind up the session. So thank you again, once again, Rachana, for the presentation as well as for everyone for good listening. Thank you so much.
Okay, let me thank our faculty firstly. I thank Ms.Neeraja for the wonderful session on psychosocial issues. I thank Ms. Rachana for a beautiful presentation of the case. And I thank all of the participants for the interactive intervention you had done today, because I got more interaction today when compared to the previous days. So thank you everyone for that. Today there will be end of life care. That will be our last session of this batch. So don't miss it. Dr. Sridevi will be handling the session. I request all of you to be present tomorrow. Okay, thank you everyone for the attentive listening and interaction. Thank you so much.
Thank you, ma'am.